This is a 32-year-old patient who approximately 4 or 5 years ago noticed some lumpiness over the top of the foot on the right side, one-sided, and after a while some swelling of the toes as well. After a while saw a general surgeon who ordered an MRI of the foot, and this MRI showed that it was suggestive of a lipoma on the dorsum of the foot, and he recommended one of two options. One was to do a liposuction, but somehow in the translation or the way he explained it, he was planning on doing large incisions and didn't know if the incisions would close. Nevertheless, he did not do the liposuction. Liposuction is typically done to tiny little port incisions, and there's no big incision, so there's some kind of misunderstanding there from the physician's perspective, or making an open incision and removing this lipoma. And this patient saw us for this swelling in the foot, and we got a copy of the MRI, and the MRI basically shows this area on the top of the foot there, which is, it's got some, can you hold this? Oh, hold that. It's got this whitish area where there's hyperattenuation. This is the cross section of the foot, and also on the lateral aspect you can see this fullness on the dorsum of the foot near the toes, and that's all hyperattenuated, and you can see more water density in it, which is consistent with a lipoma. And we've treated the patient with some bioflavonoid materials, and the swelling has gone down significantly. So there's an element of lymphedema. Lymphedema typically is swelling below the ankle in the foot and toes, and she's had significant improvement in her symptoms and the way the leg is. So you can see the normal foot, and then you can see slightly swollen right foot. It was significantly worse before we started the treatments. This is Dr. Karamanoukian from veins.com.